Sit closer. Let me take a look at your hands. Do you see that glossy shine or the barely noticeable groove? The nail plate is the true black box of your body. In 80% of cases, systemic failures leave their mark here. Cirrhosis or even cancer manifests here 3 to 6 months before the first pain. Everything that's happening inside is encoded here. Today, I'll teach you how to read this secret medical chart. You'll learn 5 markers that require an immediate trip to the hospital. The information in the video is for informational purposes only. Please do not use it for self-treatment. If you find the described symptoms in yourself, this is a reason not for panic, but for a scheduled visit to the doctor. Only a specialist and laboratory tests can provide an accurate answer about your health status. With you is I, Dr. Maria Nikolskaya, a therapist with 10 years of experience, consultant on healthy aging. Look closely at your palms in bright sunlight. Your nails constantly grow and absorb every molecule from your bloodstream. This is a living logbook of your condition for the last 24 weeks. Every cell here holds the memory of your nutrition and oxygen levels. The nail is like the annual rings of a centuries-old oak in the taiga forest. It impartially records every fall and every rise of yours. If a fire broke out inside, gray ash will definitely remain on the surface. Today, we'll learn to decipher these secret signs of your body. I'll tell you how to determine the date of the strongest stress from a deep horizontal groove. We'll pinpoint the time of your last life crisis with accuracy to 1 week. This line freezes in the horny layer like an old scar on the skin. It shows the moment when the body threw all its resources into simple survival. Then we will discuss the frightening symptom of drumstick fingers on your fingertips. The tips of the phalanges become round, dense, and strangely warm to the touch. This is an emergency signal that your lungs are catastrophically short of air. Often, behind such a change in shape lies a dangerous tumor in the chest. The body tries to save the tissues by expanding the small vessels at the very tips of the hands. We will examine the insidious syndrome called Lindsay's nails. This is a two-toned plate where a deathly white color meets a sharp pink edge. Such a clear boundary means that your kidneys are working at the limit of their capabilities. They can no longer effectively cleanse your blood of accumulated toxins. You will learn why small white spots are rarely associated with a simple vitamin deficiency. Behind them may hide systemic poisoning by heavy metals or salts. Your nails conduct a free diagnosis every second of your lung life. You just need to learn to notice these important clues in time. I will help you see what is usually hidden from inattentive eyes. Together, we will go through all 5 main markers of your precious health. This knowledge will help you avoid many serious problems in the future. Let's start reading your personal story from the tips of your fingers right now. Your body never lies if you know how to listen to it properly. Mark, 46 years old, came to me. He complained only of mild shortness of breath, but I immediately looked at his hands. A mechanic, strong palms. However, the tips of his fingers had become wide, and his nails were curved, resembling the backs of shiny beetles. Mark thought it was calluses from work, but when I pressed, I felt a frightening springiness. The plate seemed to float on a soft cushion. 6 months later, the diagnosis was confirmed, a large tumor in the lung. There was no cough, no chest pain, only these drumstick fingers were trying to warn of the catastrophe. The body was in panic, expanding the vessels at the fingertips, but Mark ignored this signal. Another dangerous marker is Terry's nails. The nail plate becomes white and opaque, like frosted glass, with only a narrow pink stripe remaining at the edge. This occurs in 80% of people with serious liver damage. The skin hasn't turned yellow yet, you feel energetic, but cirrhosis has already begun its destructive work. With kidney problems, the picture is different, half and half syndrome. The lower part of the nail is deathly white, the upper part is pink or brown, with a very clear boundary. This is a sure sign that the kidneys have stopped filtering the blood, and toxic waste is accumulating in the tissues. Pay attention to the lunulae as well, the white half-moons at the base. Their disappearance indicates that your engine is running on overdrive, shutting down power to secondary systems to prioritize the heart and brain. And if the nail surface has become rough, like a thimble, covered with small pits, this is a signal of an autoimmune attack on your own tissues. But the most insidious is a thin, dark, vertical line. It looks like a splinter, but if the stripe doesn't grow out, it's bad news. This could be a hidden melanoma growing in complete silence. Ignoring these markers means turning a blind eye to the results of a free MRI that your body performs for you every morning. Pain is already a cry for help, while nail changes are a quiet whisper. Learn to hear this whisper before it turns into a tolling bell. Look at your hands right now. What are they trying to tell you at this very moment? A nail grows at a rate of 0.1 millimeter per day. For the body, this is an endless record of its internal chemistry, similar to the annual rings of a tree. If the year was dry, the ring is thin. If there was a fire, a black mark remains. The nail likewise records the blood composition and oxygen levels in real time. Under the cuticle hides the matrix, a factory for producing cells. As long as everything is calm, the conveyor belt keeps running. A professional, late middle-age female doctor's voice. The tone is empathetic, warm, and trustworthy, like a private consultation. She speaks clearly but naturally, not like a robot. She uses significant pauses before important medical terms and drops her pitch slightly when discussing serious symptoms like melanoma or heart failure to emphasize importance. She takes audible, soft breaths between long thoughts to sound human and alive. The pacing is moderate, slow enough to teach, but dynamic enough to keep attention. But in a serious crisis, infection, intoxication, the body switches to survival mode, prioritizing the heart and brain while shutting down the nails. The factory stops and a deep trench forms on the nail plate, Bowes line. In 2020, scientists from the Mayo Clinic confirmed the link between these lines and COVID-19. The body was so preoccupied with the virus that it forgot about the nails. By measuring the distance from the cuticle to the depression, you can calculate the date of illness. 1 millimeter equals about 10 days. This is the precise math of your survival. Sometimes the malfunction looks different. In chronic oxygen deficiency, the blood vessels at the fingertips dilate, trying to nourish the tissues. The tissue under the nail swells like a sponge, and the fingers turn into drumsticks. This isn't cosmetics, it's a cry for help from the lungs or heart. Now about the kidneys. The journal Nephrology 2018 proved the specificity of Lindsay's nails exceeds 90%. The lower half of the nail turns white from edema, while the upper half remains pink or brown. This is nearly 100% a signal of azotemia, when the kidneys fail to filter the blood and the body is poisoned by waste products. Let's debunk popular myths. White spots, leukonychia, these are almost never a calcium deficiency. More often, they're just air bubbles from microtraumas. But stay vigilant. If there are many spots, it may indicate heavy metal poisoning, lead, arsenic. Yellow nails. Late middle-age female doctor's voice. The tone is empathetic, warm, and trustworthy, like a private consultation. She speaks clearly but naturally, not like a robot. She uses significant pauses before important medical terms and drops her pitch slightly when discussing serious symptoms like melanoma or heart failure to emphasize importance. She takes audible, soft breaths between long thoughts to sound human and alive. The pacing is moderate, slow enough to teach, but dynamic enough to keep attention. Yellow nails? 95% of people rush for antifungal ointment, but often it's yellow nail syndrome, a sign of lymph stagnation or chronic bronchitis. The nails literally suffocate, stop growing, and turn yellow. And if the nail becomes dry and flakes like old plywood, don't rush to take vitamins. This is a common sign of hypothyroidism. The thyroid gland has slowed the rhythm, metabolism has dropped, and nutrition simply doesn't reach the fingertips. Old doctors used to diagnose just by looking at the hands. The body is a perfect system that doesn't know how to lie. Every groove is an encoded message. Learn to notice how your nails change after a cold or a diet switch. There, at the fingertips, the entire truth about your health is recorded. Take care of yourself and don't forget to look at your palms. How to restore this logbook. The first step is biotin, vitamin B7. It's the cement for your nails. You need a dosage of 2,500 mcg daily. Nails grow slowly, so no miracle will happen overnight. But in 3 to 4 months, the plate thickness will increase by 25%, and it will stop bending like paper. Now about diagnostics. If the nails have become convex, don't guess. Take a pulse oximeter. If oxygen is below 95%, tissues lack air, you need to check the lungs and heart. If the color of the lower part of the nail has changed, get a blood test for creatinine and urea. This will show if the kidneys are coping with cleansing the body. The golden millimeter rule. Empathetic, warm, and trustworthy, like a private consultation. She speaks clearly but naturally, not like a robot. She uses significant pauses before important medical terms and drops her pitch slightly when discussing serious symptoms like melanoma or heart failure to emphasize importance. She takes audible, soft breaths between long thoughts to sound human and alive. The pacing is moderate, slow enough to teach, but dynamic enough to keep attention. Golden millimeter rule. Measure the distance from the cuticle to the Bowes mine, transverse groove. Remember, 1 millimeter equals 10 days. This way, you'll accurately calculate the date of the failure or the infection you had. This is your map to victories over diseases. Start a useful habit. Once a month, take photos of your nails without polish in daylight. This is the most reliable way to notice changes over time, better than any memory. And the main thing about manicure, thick gel polish works like masking tape. It hides the onset of serious diseases. Take breaks every 3 to 4 weeks to conduct an honest review of your health. If you need a deep analysis, sign up for capillaroscopy. The doctor will assess blood flow under a microscope, or submit the nail itself for microelement analysis. This will show deficiencies or toxins from the last 6 months. What not to do. Don't rub expensive oils trying to remove deep grooves. Bose lines are a scar inside the matrix. Oil won't smooth it out. Don't take calcium by the handful because of white spots. Most often, these are just microtraumas, and excess calcium will only harm your blood vessels. Red flags. Act immediately. A single dark vertical stripe, rule out subungual melanoma. Tiny red splinters under the nail. These aren't splinters, these are splinter hemorrhages, a sign of heart valve infection. I remember a patient who complained about such splinters and joint fever. The professional, late middle-age female doctor's voice. The tone is empathetic, warm, and trustworthy, like a private consultation. She speaks clearly but naturally, not like a robot. She uses significant pauses before important medical terms and drops her pitch slightly when discussing serious symptoms like melanoma or heart failure to emphasize importance. She takes audible, soft breaths between long thoughts to sound human and alive. The pacing is moderate, slow enough to teach, but dynamic enough to keep attention. We sent him to a cardiologist in time. It was heart inflammation. Delay could have cost him his life. Your body is a single wise mechanism. Don't suppress its signals with random pills. Vitamin, saturation monitoring, giving up excess calcium, and attention to red flags, that's your strategy. Spend a minute examining your hands tomorrow morning. Your health is at your fingertips. Tomorrow morning, approach the window. Ideally, the nail bed should be a tender pink, like a peony. Immediately perform the capillary refill test. Press on the nail until it turns white and release sharply. The pink color should return faster than you can say 2. If it takes 3 to 4 seconds, this is a signal that the heart is struggling. Once a week, perform the Shamroth test. Firmly press your index fingers together with nails facing each other. A tiny gap in the shape of a diamond should remain between them. If there's no window and the fingers fit tightly, this is an alarm bell from your lungs or heart. Close your eyes and run your finger over the nail's surface. It should be smooth, like a sea stone. Feel ridges? The body has recorded the history of your illness. Never file these ridges with a buffer at the salon. You're destroying evidence for diagnosis. Don't ignore the emptiness under the edge of the nail, onycholysis. Many confuse this with fungus, but if the nail is lifting from the skin, the thyroid is often to blame. A professional, late middle-age female doctor's voice. The tone is empathetic, warm, and trustworthy, like a private consultation. She speaks clearly but naturally, not like a robot. She uses significant pauses before important medical terms and drops her pitch slightly when discussing serious symptoms like melanoma or heart failure to emphasize importance. She takes audible, soft breaths between long thoughts to sound human and alive. The pacing is moderate, slow enough to teach, but dynamic enough to keep attention. It speeds up metabolism so much that tissues can't keep up with growth. If your hands are trembling too, rush to an endocrinologist. Remember this checklist of 5 signals. Bowes lines, deep transverse ridges, scars of past crises. Lindsay's nails, white at the bottom, pink at the top, kidney problems. Terry's nails, completely dull and white, liver pathology. Drumstick fingers, round, bulky fingers without a gap, lungs, heart. Dark vertical stripe, risk of melanoma. Keep this list in mind. Your hands are having a confidential conversation with you, and it's better to notice a problem at home by the window than to smell the hospital antiseptic. Don't cover these messages with polish. Use your personal early warning system wisely. Your nails are not just hard plates at the ends of your fingers. They are your personal and absolutely free daily checkup of the entire body. Every morning, they show you a fresh report on the work of your heart, liver, and kidneys. You can feel their smoothness or notice a strange shade in the light of the kitchen lamp. Look closely at your fingers, as if seeing them for the first time in your life. You feel the warmth of your skin and see even rows of cells under the transparent plate. A healthy nail should be tender and pink, like the morning dawn over a quiet forest. It reflects light and seems almost transparent at the very tips. But if it has become dull, like old silver, your body is asking for help. A professional, late middle-age female doctor's voice. The tone is empathetic, warm, and trustworthy, like a private consultation. She speaks clearly but naturally, not like a robot. She uses significant pauses before important medical terms and drops her pitch slightly when discussing serious symptoms like melanoma or heart failure to emphasize importance. She takes audible, soft breaths between long thoughts to sound human and alive. The pacing is moderate, slow enough to teach, but dynamic enough to keep attention. Any change in shape or color is a reason to visit the lab and get tested. If you didn't pinch your finger in the door, the nail won't become crooked for no reason. The body sends you a signal through the keratin structure when a quiet storm begins inside. Get a blood biochemistry test if you see something new and incomprehensible on your hands. Your hands learn about the illness much earlier than you feel the first real pain. They are like sensitive antennas that pick up interference in your health first. This knowledge gives you a huge advantage and time to maneuver. Don't ignore these short messages that nature writes to you right on the tips of your fingers. Sometimes one small ridge or light spot can save your entire life. This is a mirror of your attitude towards yourself and your future. Your body believes in your wisdom and always gives you a chance to fix everything in time. Look at your nails right now while we're drinking this aromatic tea. Do you see that very small gap in the Shamroth test between your fingers? Write to me about it in the comments under this video. And be sure to subscribe to my channel to better understand the complex language of your body. And in the next video, I'll tell you about your tongue. We'll find out why its coating and color can be more important than any complex MRI.